Hi, I'm Dr. Paul Kaiser, Medical Director of Penn Medicine, Princeton Medical Center's stroke program. It may seem hard to believe, but every 40 seconds someone in the United States has a stroke, and every 3.5 minutes someone dies as a result of a stroke, according to the American Heart Association. Those numbers may seem shocking, but the reality is, if you quickly identify a stroke and seek immediate emergency medical attention, you can increase your likelihood of survival. In fact, if caught early enough, patients can benefit from advanced treatment that may reverse the stroke. For example, clot-busting medications must be administered within 3 hours of the onset of symptoms, and it can prevent some of the disabilities a stroke may cause. A stroke occurs when a blood vessel that carries oxygen and nutrients to the brain is either blocked by a clot or ruptures. When that happens, part of the brain cannot get the blood and oxygen it needs, which causes brain cells to die. Stroke can be caused either by a clot obstructing the flow of blood to the brain, called an ischemic stroke, or by a blood vessel rupturing and preventing blood flow to the brain, which is called a hemorrhagic stroke. A third type of stroke, a transient ischemic attack, or TIA, which is also known as a mini-stroke, is caused by a temporary clot. Signs of a stroke include numbness, weakness, or paralysis of the face, arm, or leg, especially on one side of the body, sudden confusion, difficulty speaking or understanding, difficulty seeing in one or both eyes, trouble walking, dizziness, loss of balance or coordination, or severe headache. When a stroke occurs and blood flow can't reach the region that controls a particular body function, that part of the body won't work as it should. The effect of a stroke depends primarily on the location of the obstruction and the extent of brain tissue affected. While strokes are most common in people aged 60 and over, they can occur at any age. Hispanics and African Americans experience strokes more often than other ethnicities. While it's not clear exactly why these groups have an increased risk of stroke, studies have shown that Hispanics and African Americans tend to have at least one risk factor that makes them more susceptible to stroke, such as high blood pressure, obesity, diabetes, and high cholesterol. Women are also at higher risk for stroke. In fact, according to the American Stroke Association, stroke is the number 3 cause of death in women. Stroke risk increases in women who are pregnant. Pregnant women are 3 times more likely to have a stroke as women of the same age who are not pregnant. Have preeclampsia. This dangerous condition of high blood pressure during pregnancy doubles stroke risk later in life. Take birth control pills. These can double the risk of stroke, especially in women with high blood pressure. Use hormone replacement therapy. Have migraines with aura and or smokers. Have atrial fibrillation. This condition, characterized by irregular heartbeat, can increase stroke risk 5-fold. General risk factors for stroke that everyone should be aware of include high blood pressure, high cholesterol, diabetes, sleep apnea, cardiovascular disease, family history of stroke or heart attack, COVID-19 infection, smoking. While some risk factors for stroke are out of your control, there are things that you can do to reduce your risk for having a stroke. For instance, keep your blood pressure, cholesterol, diabetes, and heart conditions under control by following your doctor's recommendations for medications and lifestyle changes. Not smoking, maintaining a healthy diet, exercising regularly, and reducing your stress as much as possible can also help protect you from stroke. Princeton Medical Center has been designated a primary stroke center by the state of New Jersey and the Joint Commission. We have developed a comprehensive protocol to fully address the many complex needs of individuals who have had a stroke. Princeton Medical Center offers advanced carotid Doppler technology, a non-invasive ultrasound technique to assess a patient's risk for stroke, as well as other neurological imaging studies. Our primary stroke center includes specially trained acute stroke teams available 24/7, led by a medical director who is board certified in neurology and cerebrovascular disease, state-of-the-art neuroimaging capabilities and neurosurgical services, which are available 24/7, and a dedicated stroke coordinator who oversees patient education and ensures that each patient receives the highest standard of care. Patients in the stroke center receive speech, physical, occupational, and psychological therapy. Patients who require more intensive therapy before returning home can be admitted to our on-site acute rehabilitation unit. As a multidisciplinary team, our goal is to help each patient resume life after a stroke as quickly as possible.